Welcome to our number 39 open mic webinar. For this week, the topic of our discussion will be on epilepsy, advancement in this area.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund, Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities. Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
For this video, I'm going to share with you a recap of what our medical and scientific advisory, Dr. Alina Hosi, presented to our team. And I know that medicine and science is boring to most investors, but for biotech investing, understanding the science and medicine will give you a very strong edge in picking biotech stocks that can give you multiple fold return in the coming years. So even though it's boring to you, it's very important that you build your foundation, a solid understanding of the science and medicine, and that will help you evaluate the lead drug of this young biotech company. That being said, I'm going to go ahead and share with you the summary of what Dr. Alina presented to our team. First, Dr. Alina went into the definition of epilepsy, which is the unprovoked seizure without any cause.
So the topic of today is the innovations in epilepsy management, the current advances and the future prospects. The definition of epilepsy is a brain condition that causes recurrent seizures. The neurological disorder, like I said, brain epilepsy is a neurological disorder characterized by recurrent unprovoked seizures and affects brain activity.
And next, Dr. Alina talked about the etiology or the causes of this condition, which is a combination of both genetic and environmental. For environmental damage to the brain itself,
most of the reasons for this happening are various. Actually, they are genetic factors that are inherited conditions that affect brain function. They are structural causes like brain injury, tumors, strokes, infections. They are metabolic causes. Those are conditions affecting the brain metabolism. And other conditions are immune disorders such as autoimmune encephalitis.
Next, Dr. Alina talked about how epilepsy affects on the body, like the confusion and the seizure itself. It could cause impairment of the breathing.
Most of this, obviously, it's how does it affect the rest of the body. So the seizures are convulsions. They are sensory disturbances and can cause loss of consciousness. During that time, there could be injury risk during the seizures. There are muscle contractions. Patients can have cognitive impairment, memory issues, or even mood disorders.
And more interestingly, Dr. Alina went into the treatment. First, she discussed about the conventional treatment for epilepsy, which is the AED, anti-epileptic drugs, and also there's a surgical option available as well.
The treatments and the outcomes are kind of the important parts. The most common way of dealing with seizures is prescribing anti-epileptic medications such as carbamazepine, valproate, and lamotrigine. Those are medications most commonly prescribed, and the way that they work, they decrease the neuronal excitability by altering various channels such as sodium, potassium, or calcium, thereby altering this abnormal activity and neuronal activity in the brain.
Now, there are new trends in epilepsy treatment. Dr. Alina went over cannabidiol, which is medicine that is derived from the cannabis plant. It found to be work efficaciously and is being developed or innovated by GW Pharmaceutical. Very, very interesting drug.
There are new medical trends and the new medications. The one really interesting is the cannabidiol. It's a cannabis-based treatment, and this is a medication that has the affinity for multiple targets and can cause a functional modulation of neuron excitability at various receptors, but without the psychoactive consequences. These medications most of the time is used in combination with the anti-epileptic drugs. Doesn't really have that much effect on its own by controlling or stopping the seizure.
You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.